Hello, bright minds. So I've been attending a lot of conferences recently, and whenever I go to conferences, people keep on talking about clinical papers and research analysis and how clinical trials work. Nobody is unfortunately talking about what they do in their real life, and that is something which pinches me. So with this reason in our head, I'm planning to start a podcast where I get the brightest minds of ophthalmology and I discuss with them what they are doing in their real life and their perspectives on various things about life and beyond. So welcome, I am Dr. Devat Shah, and today I have a lovely guest with me. He is the Associate Professor at one of the tertiary care institutes, one of the finest tertiary care institutes in India, that is PGI Chandigarh. And we have had the pleasure of having him in Indore at our place for the podcast. So here is Dr. Mohit Dogra.
Yeah, thank you for the introduction, Devat, and thank you for having me. Thank you.
So Mohit, you have a number of papers, you have been in clinical trials, I think you have more than 100 publications that I know of. Okay, your CV doesn't fit like my interview session. So, how did you develop your interest in ophthalmology? Was it always ophthalmology, or was it like a broad scale thing and then you narrowed it down?
I always liked ophthalmology. I think there were two things to it. Firstly, my father is a renowned ophthalmologist in the country. I think when I was considerably younger, and when PowerPoint presentations and all of that had just come in, my father's not going to like me saying this maybe, but he wasn't the most tech savvy person way back when. So he would always make me sit down next to him. He'd actually make notes of his presentations on piece of paper and say, make a PowerPoint presentation out of this for me. So I remember way back in 7th, 8th, 9th, 10th standard, hearing terms like CNVM, DME, wet AMD, and honestly, I used to think that those were the most sinfully boring topics or acronyms that you would not want to know. Little did I know that maybe subconsciously, because that continued for about 3 to 4 years, that sometimes at that age, things tend to seep into your mind, even though you externally might be feeling that this is not something that you like. I always liked medicine. I come from a family of doctors. My mom and dad are doctors. My mom is an OBGYN. And despite my mom being very clear that she did not want me to be a doctor after 10, God was kind. I was bright enough to score decent marks to either choose medicine or non-medical at in good colleges. But I always wanted to be a doctor. And after that, one thing for the ophthalmology is the thing that I talked about with dad. The other thing was I think I was brought up in Chandigarh. My schooling, my graduation was there. I've looked at the PGI. I've known PGI since I was very young because it was a place where my mom and dad trained and worked. My dad continues to work, and where I used to go for all of my ailments, all of my checkups, all of my friends' parents were doctors there. So I've grown up next to PGI. And I know the eye center, which is there at PGI, and I knew that it's one of the state-of-the-art facilities to do ophthalmology in our country, if not in Asia. And so I think it was a combination of all those factors that kind of led me to try and take up ophthalmology.
Lovely. Okay. So, a tricky question. A lot has been said about nepotism. Especially recently, since the past 2-3 years, people have been, talking the easy way out. Okay, talking about how it is easy for a kid whose father is an ophthalmologist to navigate in the industry. Okay, but I have so many friends whose fathers are renowned ophthalmologists. One of them is you, and I know they have not had it easy. So, what do you feel? Because I know you per se have gone through a lot of struggle being one of the star kid of one of the pioneers in ROP. So, how What is your take on it?
Well, that sounds like a Bollywood question, but yeah, again, without underplaying the issue, I think definitely nepotism exists. It exists at different levels. It can be institutional, wherein if the owner/proprietor of XYZ company would want their own people to present at conferences, they will push papers, conferences. They might even try and influence certain decisions of free papers or posters or videos, because all of that adds to the glory, of that institute, of the name of the XYZ person. So there is some nepotism there, which is not the traditional sense of nepotism that we tend to talk about, which is familial, right? Which is dynastic. Coming back to the more widely kind of understood and maybe appreciated. And again, I'm going to cite my own example. My father, Professor M.R. Dogra, one of the pioneers of ROP work in our country, a vitreoretinal surgeon from late 80s, early 90s, trained abroad, and God's been kind, hugely respected. He's a small town boy, came from a village up north. In the interior of Himachal, is studied in a Hindi medium school till 8th. Belongs to an agricultural agrarian family. My late grandfather and my grandmother both are illiterate. My grandfather was, and my grandmother is illiterate. He's the eldest of 9 kids, and he, despite being the eldest of 9 and staying in a village, doing his Hindi medium work, was able to, because of his single-minded dedication and his hard work, make it first to IGMC Shimla for his MBBS, and then from there on to PGI Chandigarh for his post-graduation, and then continued to meet my mum there, and then have a life and settle down and be there. So that was that. So no nepotism for him, because he came from an agricultural family. Yes, I was born in 1983. My mom and dad were senior residents in PGI at that time. I was born in Chandigarh. My mother was also my mother was an OBGYN specialist, was also in PGI for a decade after that. After which she continued, she left, and then she had her own private practice. To say that I had it a bit easier than my dad had, absolutely. I did not. I was born in a city. I received excellent convent education. My commute to my school was 10 minutes from my house. My commute to my college was 15 minutes from my house. My commute to my postgraduate place and my work is 8 to 10 minutes from my house. I stay in Chandigarh. All of that is because my parents moved to Chandigarh. They gave me that opportunity. So yes, I have a stark advantage over what my parents had. Absolutely. Coming to the second point regarding typically ophthalmology, and whether in ophthalmology there's a advantage of having a father, and that to someone as celebrated as my father. I'd say yes, and then I'd also say no. And why I would say yes and no is yes, because of the multiple reasons that people already know, and why I would say no is again, citing a personal example. I went to a government medical college for my MBBS. I cracked the All India and the Chandigarh PMT and got a seat in. God was kind, and I think I put in some amount of hard work, and I think I was decently bright, without sounding
more than decent.
You're kind to say that. I was able to crack the PG entrance exam, which is an all India exam. Most people know. There are a lot of people taking that exam, and I wanted to do ophthalmology. I had a decent rank. I was getting what people at that time termed better branches, but I was very sure I wanted to take up ophthalmology. I did. I was very sure I wanted to take up vitreoretina as a specialty post that. I must credit all my mentors, including Professor Dogra at the PGI Eye Center, for allowing me that opportunity, as they allow every other person who does PG there and gets into a senior residency postgraduate program to select the specialty of their choice and train in that. I got that. Post my post-graduation, I did not get into a senior residency program straight away.
So this is what I want to understand. In spite of having such a staunch background with mother, father being the top heads of PGI, your post-graduation thing and life after that has been a struggle, right?
Well, I wouldn't say it's a struggle. I think.
You didn't get it easy.
Yes. Well, I didn't get it as easy as people might think I did or I should have had. And I don't think I should have had it any more easier than anybody else. And I didn't. And I'll just tell you how. So after my postgraduate exam, I took the senior residency exam for PGI, which I could not clear. And I did not get in. I worked at another sister institute in Chandigarh for a year and about 3-4 months because there was no seats for a senior residency exam for that duration, and I could not come back to PGI.
Okay.
Approximately a year and a half into my training there was an opening of a senior residency exam, which I took again for PGI. I cleared it this time, and I got into senior residency in PGI at that point. Continued to do 3 years of my training there. Took an extension for 3 more months because I wanted to try and apply for a faculty position, and there were no faculty posts coming in. I took up a pool officer or a research job, which I was working in PGI, but it was actually my designation was that of a SRA or a Senior Research Associate.
Okay.
And I did that for 1 year.
Okay.
Following which I gave my first interview for my faculty entrance, and as is the case with most institutes of national importance for getting into a faculty program, it's uber competitive with lots of people with excellent resumes, who you have to compete with. And despite all the nepotism thing that you can say that my father was the head of the department at that time, the head of PGI was Professor Jagat Ram, who was also from ophthalmology. And me being from PGI, because I did my PG there and my senior residency there, I did not get the faculty position at the first time. I had to wait 1 more year. I took the interview again. I worked on my resume. My CV got better. I tripled my number of publications. I went back stronger, and again the stars aligned. God was kind. One more time, and I got into a faculty position. So if nepotism gives you all those opportunities, and then I want that kind of nepotism for everybody.
Amazing. So post MS, 1.5 years of work, then 3 years of SRship, that goes to 4.5 years. Then again a year and a half, 2 years of training, so that goes to 6.5 years. So you approximately spent 6 to 7 years post your MS just to get to a faculty position.
Yes.
So the bottom line is, I feel nepotism, it is there. Of course it is there. But I feel these kids are targeted even more than the usual kids, because unfortunately or fortunately they have been born in that family. So I don't think it is as easy as people quote, even for them to get to a position where maybe you or anybody else. Okay, so Mohit, these days I think every month there are 3 to 4 conferences. It has become very rampant. Everybody is traveling. So what conferences specifically, if I'm like a guy who is just out, what specific conferences should I attend, okay, to enhance my knowledge or for networking or whatnot?
So again, I'm enjoying your excellent hospitality here in Indore at this, at this CME. So yes, I agree. There are lots of conferences happening. There are lots of CMEs happening. Some of them are, geared towards academics. Some of them not quite so much. But I think you have to kind of separate the wheat from the chaff and have to have a clarity in your mind as to why you want to go to a particular conference. It could be, multitude of reasons. If you harbor ambitions of getting into political posts in, let's say, AIOS or your state ophthalmic societies, then of course, the number of conferences that you might want to go to, the networking that you might want to do is different. So, then academics might take a bit of a backseat. That might not be your cup of tea. You might be the complete opposite, and you might just want academia. You might just want to upskill, might just want to learn that fine nuance or something that a lot about but want to know more for. In that, if that is more your cup of tea, then I think you should try and really, sift through the fine print and look at the speakers. And you have to. So if you have people coming and speaking on topics in which they have original contributions, and then I think if your aim is upskilling to actually sitting in conference rooms and listening and actually getting some crucial information out of that, then I think original people who've done original work in that particular field, if they're talking, then I think hearing it from the horse's mouth is always better. Then of course you have your all India conferences, be it AIOS, maybe the midterm AIOS, or larger regional conferences like the Bombay Ophthalmic Society or the Delhi Ophthalmic Society or similar conferences. I think those are great for networking depending on which region you're in. They're also great if you want to meet the industry, if you want to try and keep abreast of what's happening on the industry, the pharma side. I think it'll actually help you there as well. But I think it's important to try and target what you want and then try and pick and choose a conference.
Oh, lovely, interesting. Recently, oncology in vitreoretina has been coming up. Okay, so again, how important it is, and how do you foresee this branch evolving?
I've been doing some of that for the past 2 years. It is a very niche subspecialty of vitreoretina. It is something that will only grow as the time goes by. But I think it's very, very important to try and look at intraocular oncology, both adult and pediatric, because for a long time, a lot of the intraocular oncology, especially the complications of tumors, were being managed by VR surgeons. But the primary management of the tumors, the malignancies, or maybe the benign tumors, was being either done by a ophthalmic oncologist or oculoplastics person who was trained in oncology. But I think if it's the same person, like with any other stream in medicine, who's taking care of both the primary treatment of a disease, which in this case is tumors within the eye, not extraocular, and also following up those patients and trying to deal with the complications that might happen either secondary to the tumor per se or the treatment that you might do for the tumor, then I think it becomes just a more complete, more well-rounded package, not just for the patient, but also for the doctor. And it's I think better managed by someone who can also try and deal with certain complications like vitreous hemorrhage, traction retinal detachment, dermatogenous detachment, excision of certain masses or whatever, as opposed to those being referred or sent to you just for particular surgery, and either side of that you're not able to follow them because the treating doctor is somebody else. So I think it's interesting times. It's interesting times for for onco VR. Not too many people do it, but it is something that, as I said, is very, very dear to my heart, and more people will realize the importance and the need for a VR person to be more closely associated with intraocular oncology than was thought previously.
So again, a little out of context, what apart from ophthalmology, how do you look at life beyond ophthalmology? What interests you? What are your hobbies? Something which is, maybe if you're not an ophthalmologist, where would you have been?
Oh, well, that's a good question. I answer that a lot to a lot of my friends, when we're socializing. I'll answer that in two separate parts.
Right.
The first part is hobbies beyond ophthalmology. And second, maybe then what I might have been had I not been an ophthalmologist. So hobbies beyond ophthalmology, I like to travel. I think that is
I know of
that is of
across the globe.
Yeah. Well, domestically and abroad, yes. It's easier to travel now because of all the changes happening. The world's shrinking. It's becoming a more traveler-friendly place. So yes.
You travel when you are going, especially abroad when you are going. Do you club it with a conference, or you tend to travel like?
So both. So both ways.
Okay.
When I get vacations, which thankfully we do get, me having the opportunity to work in a government institute, During vacations when I travel, I just travel because I want to travel as a traveler and not as an academician who can pack in a couple of extra days. But if it is, but once in a year, I will do international travel to a conference, which will be something that I've handpicked.
Okay.
And which will and the idea is to kind of hit two birds with one stone, if you can use that analogy, of me being able to get some academic content out of that foreign travel, as well as see that area, see that place, enjoy the the sights and the sounds and the food. So one is travel. The second is I'm a big foodie. I like to I understand food. I read up about food.
Do you cook?
I cook. So I barbecue a lot. Barbecue is something that I do. Up north where I come from, winters can be pretty cold, so it's excellent barbecue weather. And it's also very communal because you can have friends and family over, and they'll actually stand by around your barbecue, and it's a good time in evenings to be with friends. My only Achilles heel is that I cannot dice or chop onions and tomatoes, which is also, by the way, a big convenience for me. But I do understand all the Indian tadkas and what proportion goes where. How
so you just don't eat; you understand what you are.
I understand. So travel and food is what I like. The other thing, if I wasn't an ophthalmologist, I'd say one of two things. I might, some of my friends say you should try and start a food vlogging channel. Yeah. And oblique or try and do some stand-up comedy.
But you are anyway not there on any social media.
Well, then that answers that. But I'd say I'd be a chef. If I wasn't, I'd be a chef. I think that's I really enjoy being in and around the kitchen, whether it is being food made or taking food from a prepared pot into my own plate. I like both.
So maybe we can fulfill that dream in the coming years.
Well, you never know when.
So I see a lot of young guns today who have this aspiration that we'll work till 45 or 50 and then we'll earn a lot of money and then we'll retire and we'll enjoy our life. Do you believe in that concept?
Short answer, no. No. Yeah. I'm a bit old school in as far as that is concerned. I'd say if you're doing medicine, and mind you, ophthalmology is medicine. Some people might choose to think otherwise, but ophthalmology is hardcore serious medicine. I think yes, you have to have personal ambitions. You have to have you yourself, your family. Everybody has to be well taken care of, and you have to contribute and provide for your family. I'm not making a socialist or a communist argument here at all, but what I'm saying is there is a duty incumbent upon you if you chose medicine, and I'll repeat again, ophthalmology is a part of medicine, to at least have some amount of service or the concept of service or the feeling of service ingrained within you. And if it's not, it's not, but this is my take on it. I think this is not like an engineering degree or an MBA program or some other degrees where I think primarily where this concept actually came from. That my retirement age is going to be 45 or 50 or whatever, and after that my investments and all of that, I'll have enough money in the bank or I'll have a recurring source of income which is going to keep me afloat and make me enjoy a good life. Yes, please do that by all means, and you can do that while practicing medicine, because I think it is a duty which I feel it is a duty that you need to fulfill. Sure. Apart from taking care of yourself, having a good time, taking care of your family, and try and look beyond what your non-medico friends might be saying and doing. I'll in fact go on the limb and say, if you don't feel like that, then I think you did a disservice to yourself and maybe to the larger community at hand by doing medicine in the first place. Or because you could have chosen something which would have taken lesser number of years, and then you could have done the same thing. Having said that, nothing or nobody is stopping you from doing what you said, which is currently the in fad thing and sounds very cool and is great. But again, I think
not in our field.
And yes, I'm not one for Marvel or DC comics, but quoting whether Spider-Man or Superman, with great power comes great responsibility. So if you're doing ophthalmology, which for the third time is still medicine, I think there is some responsibility incumbent upon you to have a little bit of sense of service for people.
True. Batman. So and in our field, I feel with time you tend to get better also.
Yes.
So I think what you can, what perspective you can have at 60, you might not have at 40, 45.
Absolutely.
So I think it doesn't apply to our field. And I think what you said, the service thing has to be ingrained.
Yes.
So, and over a period of time, I think you learn to have work, life, travel, food, balance.
And most people, I think, have that. They just don't realize it at that point in time. Or maybe they're looking at, greener pastures. And by that, I mean certain friends and peers of theirs who might have, in their minds, a better work-life balance. And they feel that they're somehow not there. Everybody has their own work, their own life, and their balance is separate. Some people walk a tightrope. For some, it's like walking on a highway. And some people are just drunk and they can't even do a tandem walk. So everybody has their own work-life balance. There's no one size that fits all. But I think it has to be taken into context with what you're doing. And again, if you're doing medicine, I think one should try and think of it as a bit differently.
Amazing. It was so good to have you, Mohit. So good. Such a pleasure.
Thank you, David.
Thank you so much.
Thank you.